What's up everybody, welcome back to yet another video. This is brought to you by the PT Assistants. My name is Ken, and on this channel we try to break down some pathologies just to get a better understanding of them in different ways. And today, let's talk vestibular disorders. Alright, let's just jump into what it is. So when talking about vestibular disorders, there's many different kinds of possible disorders we can be talking about. A few are going to be Meniere's disease, BPPV, ototoxicity, and acoustic neuromas, just to name a few. But what a vestibular disorder is just a disconnection between the sensory information that is processed between the ear and the brain. So these things are responsible for our sense of balance and for eye movement. Those go hand in hand. And then it can be broken down even further between peripheral being the dysfunction of the auditory or the vestibular structures, or it can be more central, so this affects more the spatial awareness or the balance aspect. However, most cases are peripheral. Getting into the how someone gets a vestibular disorder, so this goes back to there's so many different kinds, so we're going to be more broad when it comes to these. So in the younger population, it's going to be more ear infection, whiplash, and head injury. Those are the most common. However, the majority of patients who develop vestibular disorders are going to be either greater than 50 years of age, and it's idiopathic. So again, idiopathic being that we don't know the exact cause. Jumping on over to the presentation. So again, it's going to vary greatly depending on which disease we're talking about. But they can be intermittent or persistent. They can be single attack or repeatedly. It just all depends. But just some broad symptoms that they can experience are going to be vertigo, dizziness, nausea, altered balance, auditory changes, and difficulty with coordination, cognition, and memory. Jumping on over for what this means for us as PTAs. So the goals for treatment are going to be increasing their balance, both static and dynamic. So doing more balance related activities. We want to decrease their dizziness. We want to decrease their symptom related anxiety and decrease the dependence of visual and somatosensory information. So touching on that real quick, our balance depends on three systems. We depend on our vision, our somatosensory, and our vestibular. So we don't want one system overcompensating for the other two. We want them all working together. So for this last one, we just want to work on evening out every single system together. So us PTAs are going to do some techniques that involve habituation. So this is going to be a technique that helps them be less sensitive to certain movements. The body will adapt to what you're doing to it. In other words, we make walking very difficult in the clinic so that when they leave the clinic, it feels a lot easier. We have to retrain their balance for reactions, proprioception, and that VOR reflex that we touched on earlier. So some examples of these are the gaze stabilizations, looking for head movements, single leg stances on different kinds of surfaces, gait with head movements or activities with your eyes closed. You're challenging each system independently, so each system works better together. The home care that we're going to want to educate our patients on are still continuing those habituation techniques and those accommodations that their bodies are going to want to adapt to. Always trying to ensure patient safety, so here we're working with fall risk patients, so keep that in mind. One technique that I've learned is have the patient stand in a corner with a chair in front of them. So this way that if they do feel like they're falling to one side or another, they're either going to hit the wall or they can grab the chair in front of them. So make sure that you plan what they can do safely at home and what they're going to have to do while they're in the clinic. And lastly, some outcomes or some long-term effects. So again, therapy is only warranted if they've been having these symptoms for a prolonged period of time. Sometimes the symptoms themselves can spontaneously recover, or they can cause permanent disability. However, what we can do as physical therapist assistants or as PT in general is help reduce their risk of falls both at home and within the community. Alright, and that just about wraps it up for this video. If you've made it this far, thank you so much for listening. You can follow us on IG, Twitter, and Facebook, all at the PT Assistants. We also have podcasts every week where we talk about more of these subjects in greater depths or more of our experiences out in the field, so be sure to tune in. If you've had any experiences with vestibular disorders or any tips and tricks in order to remember some of these things, be sure to leave them down below. We'd love to see them. And finally, stick around for a little review at the end. Let us know how many you get right. Hope you guys take care.